Thank you so much, Ben, for the very exciting talk. Next up, we have Doina Precup, who's an associate professor at McGill University, and she's a leader in reinforcement learning. She's very passionate about applications that actually have social impact, such as healthcare. She's interested specifically in machine decision-making under uncertainty, so highly relevant and applicable talk. And these days, she's the Senior Fellow of Canadian Institute for Advanced Research, a senior member for the Association for the Advancement of Artificial Intelligence, and she also heads the Montreal DeepMind office. Welcome, Doina.
Thank you very much, everyone. I'm delighted to be here. It's a conference that was on my radar for a long time, actually, so I'm really happy to finally participate this year. I'm going to talk about reinforcement learning for therapeutics, but before I do that, I just want to give you sort of a picture, because I've been trying to work on applications of machine learning in healthcare for a while. A lot of the stuff that we've done sort of historically has been more like in the area of supervised learning, where we're trying to assess something about the state of a patient that can inform a clinician. So for example, we have an ongoing collaboration at the McGill University Health Center where we're doing cardiorespiratory monitoring in the neonatal intensive care unit for babies that are very premature, looking at the cardiorespiratory signals and trying to assess extubation readiness, as well as possibly hypoxia and other outcomes. And so this is a collaboration that was quite exciting, ongoing for more than a decade, and now sort of expanded with collaborators at UCSF in order to leverage some of the data at Kaiser Permanente and expand these studies. So this is sort of a standard time series analysis plus supervised learning. We have these cardiorespiratory signals. They're very noisy. They're very challenging to work with. But we know the outcomes of these patients. We know clinician assessments. And so we have a lot of supervised learning information that we can leverage. Similar kind of thing in medical imaging. We had an ongoing collaboration, again, for maybe a decade and a half with some of the neurologists at McGill looking at analyzing MRI data in order to detect lesions. This is specifically for multiple sclerosis patients. And a lot of the challenge here has been in trying to assess not just the labels, but to assess the uncertainty in these labels by looking also at how much inter-rater agreement there is between people and how we can leverage that information. So again, supervised deep learning pipeline in collaboration with some of the neurologists and some of my collaborators that are more sort of imaging and signal processing specialists. But my own research area actually is reinforcement learning. Reinforcement learning, as Ben mentioned in his great talk earlier, is about interventions, right? It's about action, about interacting with the world. And this has really been interesting from the point of view of implementing AI agents, but has not really been leveraged nearly as much in healthcare as supervised learning has been. The main idea in reinforcement learning is that you have some agent that's interacting with the world, it's getting observations about that world, and it's getting a reward signal that's correlated with how well the agent does, but never actually tells the agent exactly what to do. And the agent has to interpret this reward signal and then strengthen the probability of taking actions that are leading to good consequences in the long term. And so more recently, we've been really starting to explore very seriously the use of reinforcement learning in the healthcare context. And here you can think of the action as some form of intervention. In my talk, I'm going to focus on drug interventions, so administering therapeutics, or navigating a space of possible interventions. We're going to think of the state as some collection of measurements that you have about the current situation. And then the reward is going to be a whole story in its own, and we'll talk more about that. This is actually one of the critical aspects, is how do we formulate the rewards in order to capture the essence of the problem. And so we think of this process as an agent that's embedded in the environment, observes something about that environment, could be very noisy or uncertain, as discussed in the previous talk. It will take an action based on that, and then the environment is going to transition to a new situation and emit a reward. And very often we're going to make some assumption about the environment, for example, that the next state and the reward that's obtained only depends on the previous state and the action. That's a Markovian assumption that actually allows us to do a lot of nice algorithmic things and a lot of nicer math. So just some basics of reinforcement learning, because this is going to come up in a minute in our formulations. We're going to think of the agent as having a policy. A policy is a way of choosing actions. It's really a conditional probability distribution of actions given the situation. And the measure of how good these actions are is going to be the return. So the return is a long-term sum of rewards that's accumulated over time. And typically, we will have something like a discount factor that basically devalues things that happen farther into the future, maybe because the future is uncertain, or we want to truncate it at some point. And then what we want is to assess how good an action is in a particular situation. And so we're going to use these action value functions, or Q functions, in order to make that assessment. And this is simply the expectation of the return, given that the agent in the current situation does this action and then behaves according to its current way of behaving over time. And there is a notion of an optimal policy, which is the maximum over all policies of this value function. It's the best way that an agent could possibly behave. And if we make Markovian assumptions, we have actually some nice recursive equations that allow us to either compute or approximate this kind of value function. So that's kind of the math behind the scenes. Now, the question is, can we actually leverage this framework that's very well understood to learn how to do therapeutics, right? So how to administer medications, when to administer medications, how to combine these in different steps. And the first thing that we need to think of is, how do we formulate the problem? What are the states? What are the actions? What are the rewards? Secondarily, do we actually have a way of learning, right? So is there some simulation environment that we can leverage in order to learn these policies? Or is there some existing data that we can leverage? That can be a big bottleneck. And then, there's a question maybe for the people on the machine learning side of whether the current reinforcement learning algorithms are actually powerful enough or efficient enough for the problems that we have. And so I'm going to show you, if I have time, 2 case studies. The first one is reinforcement learning for precision drug dosing. And this really tries to get to the heart of the current paradox in drug development, which is that clinical trials look at populations. And so they come up with sort of usual doses that are administered in a population. But physicians actually treat individual patients. And individual patients can have very different responses to therapies. They can have adverse reactions. Sometimes there's no response to the therapy. And that's sometimes actually an effect of the fact that there's eligibility criteria for selecting clinical cohorts that go through the clinical trials. And these eligibility criteria actually exclude a lot of patients, right? Including patients that are too young or too old or that are on some commonly prescribed medications. And so this means that while we are assessing the efficacy of medications and the dosages in clinical trials, that actually does not really cover the entire population of potential patients. And there can be quite a bit of variability. So the goal of this project actually was to try and find out if we can sort of go beyond this one-size-fits-all approach and actually try to figure out on a case-by-case basis what's the optimal dosing. And this is going to be some work done in the context of diabetes and insulin, simply because there we had a simulator. But the approach is general and could, in principle, be used in other cases as well. So precision drug dosing is individually tailoring the dose of a drug to get the greatest benefit and the least risk. And we're going to try to formulate this as a reinforcement learning problem. Okay, so we might have some state for the patient, some measurement. We have actions, which are administering doses. But there's one interesting challenge here, which is that the Markovian assumption that we normally rely on in reinforcement learning actually doesn't hold. And that's because whenever you administer a drug, there is a delay during which there is no effect. Then there's some effect, and that effect gently decays over time, right? So an action doesn't just impact immediately the next state. It will impact the state of a patient over some period of time. And so this prolonged effect needs to be kind of taken into account. And so this work that was led by my PhD student, Sumana Basu, actually tries to model this problem of the prolonged effect by thinking of the next state of the patient as being a function not just of the previous state, but of the actions that have been taken before, and trying to model the effect of those actions in a way that's inspired by the pharmacology literature, so by incorporating some of the decay assumptions that are present in the pharmacology literature. And this was work that was presented at AAAI this year. And so the way that we're going to do this is to model this delayed action effect by sort of adding the action. This is like a drug dose whenever it happens, and then having a decay over time. And this decay can be informed by something that we know about that drug, but in principle, that could also actually be assessed for a particular patient and tailored to that particular patient. And so we're going to solve a problem in which we don't just look at the current state, but we take into account this sort of summary of the actions and the impact of the actions that have been taken before. And now we can think about doing this in the context of glucose control. So for this, we actually used a simulator that was developed at the University of Pisa that's quite standardly used in the literature. It has a lot of limitations. It's a simulation. It doesn't quite exactly tell you when the patient, for example, would get food and so on. But it is a standard that's fairly easy to use. Here, the observations are just blood glucose monitoring. And the action is just discretized insulin doses that can be administered. And one interesting thing that I want to point out is that in order to make this work with reinforcement learning, we did have to think carefully about what the reward signal actually is. And so in this particular case, we want the patient to stay within a certain range of blood glucose, ideally. Certainly, we don't want to go into severe hyperglycemia or hypoglycemia. Hypoglycemia is deadly. And so we need to penalize the agent approaching these sort of very dangerous ranges of the signal. We need to sort of slightly penalize when we're exceeding or we're being under a threshold. We can't put too much penalty because that can happen anyway due to physical activity and food and so on that we don't really have reflected in the state. And we can incentivize the target blood glucose being in the right range. And at the same time, one of the things that we observed empirically when we try to use reinforcement learning in this context is that these agents tend to be very trigger happy and give very high doses. And so actually, we also need to take into account that we want the doses to be relatively reasonable. So we use DQN. This was mentioned in the previous talk. It's sort of a standard algorithm as a baseline. DQN basically tries to assess the action value function by sort of comparing the current action value function with a target, a one-step target that we can obtain from the Bellman equations. And we're going to have several different policies that we look at. The first one is sort of a fixed dose thresholded policy. This is sort of a heuristic rule that says if your blood glucose exceeds a certain level, you will give this dose. If it goes even higher, you'll get a higher dose, and so on. DeepQ network is just a simple feed-forward neural network in which we take the current blood glucose and we output an action. So there's no information about the history of what was done before. ADRQN is a method that is sort of general interest for partially observable Markov decision processes. And it basically uses a recurrent neural network in which the current action just gets fed back to the agent. And so this neural network, in principle, can learn prolonged effects of actions, but actually has no inductive bias towards the fact that these are therapeutic actions and they have a sort of a decay way of acting on the organism. It's just a vanilla method that you can use for any kind of POMDP. And then we have our approach, which takes the state and the action, but then actually encodes the sort of delayed effect in the description of how the action impacts the state. And so we look at a couple of different things. First, obviously, we look at performance. Performance in reinforcement learning is typically measured as the return. And so we're comparing fixed dose and DQN. Those are the lower lines over there in the rightmost graph. And then our approach, which is the red line, and ADRQN, which is the sort of vanilla algorithm. And we see that in terms of return, we do slightly better, but not significantly better. However, in terms of computation cost, actually, which is the other graph, we are much, much better, even for longer histories of looking back in time over what has happened in the history of the patient. And the reason for that, basically, is that we have a very simple way of updating the state, and we don't need the recurrence because of that. The effect of the action is already embedded in the way that we compute the state. The other interesting thing, actually, to look at, and this is especially important in healthcare data, is actually qualitative results. So the return is a summary metric. It tells you sort of how well you're doing in terms of this measure that we've come up with that captures the task. But really, sometimes even this measure that we've thought of very hard is not quite perfect, and we want to really see what happens here, to the patient. Like, are they in a good regime? Are they somehow in a dangerous regime? And how often does that happen in these simulations? And so what you see in the green plots is the blood glucose level. There's horizontal lines that denote the normal range, and then there's red dots that basically denote effects that are going above or below critical thresholds. Okay. The second graph there is the food input. Okay. And then, the third graph, the bottom graph, if it's the food input. And then in the middle, we see the insulin. Okay, so what's being administered. And so on the top graph there, we're looking at the fixed policy where whenever the blood glucose goes above or below a threshold, there's some intervention. Okay, and so you get this policy that's sort of like jagged and administers a lot of medication. DQN actually ends up not really giving any medication, okay, because when it's exploring and it's giving medication, actually bad things happen, and so it just learns to do nothing. ADRQN, which is the sort of recurrent network approach, actually does give medication, but it ends up being very aggressive and sort of pushing the patient quite often into hypoglycemia. And so that's actually really bad. And then our approach is actually administering insulin sort of with a good clip, very often correlated with food, not always, and does not have any sort of death by hypoglycemia in these kinds of simulations, although it does end up with the patient sometimes becoming hyperglycemic. And we think that that might actually also be a side effect of how we structure the reward function in this case and how it's being used by our agent in particular. So it's interesting to look at these results because they give you a much more complete picture, not just of the summary statistic of the performance, but what are actually the outcomes that we expect for these patients. So now, just to conclude this part of the talk, reinforcement learning can really provide some effective learning methods for precision drug dosing policy, but the design of the reward function is really crucial, and incorporating specifics of the problem, in this case specifics of the drug dynamics, is really useful. The sample efficiency is still quite bad, and so what I mean by this is, like, if you look at the x-axis on that plot there, you see this is like 10,000 episodes, right? 10,000 episodes means like 10,000 patients that we've gone through for some period of time. That's a lot, right? You wouldn't be able to really do this unless you have a simulator. Simulators, of course, all come with various limitations, right? So in this case, we have a particular simulator that people consider a state of art, but when I talk to actual doctors, they do see a lot of limitations of this one. And so in other domains, too, we would need some form of simulation or a lot of existing data in order to train these methods. And really evaluating, like the ground truth evaluation should be deploying these policies with patients. And that is, very often not possible, could be risky. And so better ways of evaluation, I think, are really interesting to think about and necessary. Now, I want to show you a second case study, which is not so much patient-related, but more related to drug discovery. So a little bit of a different problem, but we're going to see some similar themes emerging. So here, the idea is that we want to do small molecule drug discovery. So we want to search through a very, very large space of possible molecules for drugs that can bind to a particular target, for example, to a particular protein. And the way that we're going to think about this process is that we might have some initial data. This data has targets and drugs that bind to them. we can use this data to assess some reward, for example, a docking score. This is an approximation, but it can be learned through deep learning methods. And this can be used to train a reward predictor. So in other words, we're going to think of searching the space of molecules and trying to predict if a particular molecule is going to bind well or not with the target of interest using this sort of approximate reward that we've learned. And this is going to guide our search through the space of molecules. Now, obviously, this reward is just a proxy. And so we're going to need actually to sometimes go back to the lab, take some candidates that are really promising, and assess them in the lab. Okay? And that's a very expensive process. So that's the sort of query oracle process. And so what we want is to identify batches of candidates that are diverse, different from each other, send them to a lab, and otherwise leverage the simulation in order to search through a much, much wider space for these really good candidates. Now, we can think of this actually as a reinforcement learning problem by imagining that we start with either an empty molecule or some kind of scaffold, and then we can add or remove blocks. And at the end, when we end up with an interesting molecule, we're going to use our simulated reward in order to see how good it is. And if we think something is really good, then we're going to take it and send it to the lab along with a batch. So that's, in principle, very clean. Okay? We have an environment in which we have actions. We have a noisy learned reward. It's imperfect, but could be useful. The problem, though, is that reinforcement learning is very focused on optimization, right? So the algorithm will try to find the single best molecule possible. Whereas in this problem, actually, what we want is to find good and diverse batches of molecules. And so from this point of view, we would like to encourage the algorithm to explore as much as possible, for example, by encouraging entropy. However, entropy is not enough empirically to get us diverse batches of molecules. In probabilistic graphical models, this problem is often tackled by Monte Carlo Markov chain methods that do sampling using the reward as an unnormalized probability. There's a lot of literature on this. But MCMC tends to be slow and also gets stuck in certain modes. So it's sort of a little bit similar to reinforcement learning. You find a good molecule, you're going to kind of stick to that, and it'll be hard for the algorithm to get out of these very strong modes. So again, not great for generating diverse queries. There's been some interesting recent work on using purely generative techniques, right, diffusion methods, to actually generate molecules from scratch. There is a reward signal here. It's more informative, right, than what's usually used in diffusion models. But again, we don't just want to get high rewards. We want also to avoid low rewards. And this is, I think, an area that's interesting to keep an eye on. But we actually, in this project, went into a different direction, partly because of our background in reinforcement learning. And we thought about a particular generative framework for discrete objects, like molecules, that is guided by rewards. Okay? And so we're going to do here reward proportional sampling, but without MCMC. We're going to think of a policy that can guide the search to sample various kinds of molecules in proportion to what their reward is. And so just to give you sort of a flavor of this, imagine that you have a tree. Okay? You start at some state. And basically, you can think of always having two actions, okay, to go to some successor state. This is maybe by adding something to a molecule, right? So we have two blocks that we're considering. We can add one or the other. That gives us a new molecule and so on. At some point, we stop and we assess using our proxy reward function. And what we would like is to sample in this tree in such a way that we end up at these leaf nodes in proportion to how good they are, okay? And so in this particular case, we would like the top path to be sampled at roughly 1/10 of the time, the bottom half about 4/10 of the time, because that reflects the relative magnitude of the rewards in these leaves. And so we can do this by thinking of estimating an action value function and the value of a state, and then having a policy that picks the actions in proportion to how good they are at every node. And so it's a randomized policy that will sometimes go up and sometimes go down. But doing this sort of naively only works for trees. Okay? It does not work for cases where, for example, we can end up at the same node by multiple paths. Okay? And it's sort of like, this is like a very simple toy example to kind of show that if you use this approach naively, you end up with wrong estimates of the probabilities. And in general, it's not so bad, but it can be really bad if we have many trajectories that lead to the same node. And that's actually quite the case in molecule space, because we can end up with the same molecule configuration by many different paths. And so we can sort of fix this problem by thinking of this graph that we're moving in as a flow network, and essentially making up flow equations that say at every node, the inflow that's coming on all the edges into this node has to be matching the outflow. And we can satisfy these flow conditions at all states, but really in practice at the sampled states, the ones that we are actually visiting. And the interesting thing is that these flow equations actually look a lot like Bellman equations in reinforcement learning. And so we can basically leverage exactly the same kinds of algorithms as in normal reinforcement learning in order to satisfy these flow equations. And moreover, we're going to use a function approximator like a neural network in order to estimate these flows. And then the policy will just be computed from the flows in the same way as we would use Q-learning. So the flow, think of the flow just as an action value function here. So we can use this objective function. This is a standard objective function that comes from trying to optimize the Bellman equation. The flows are parameterized, so these might be some bigger neural network. The problem is that these flows can grow very big because they're not normalized, okay? And so actually in practice, we don't really optimize that equation directly. Instead, we learn the log of these flows and match flows in log space. And so again, one way to think about this is, the way that we think about rewards and value functions here has to be adapted to the problem. And we sort of try to get this done in a way that allows us to leverage the structure of the problem. It's actually quite related, for those of you who are more familiar to reinforcement learning, with maximum entropy reinforcement learning. It's similar in spirit, but it uses a different mechanism. It allows us to always sample trajectories in proportion to the end reward. The rewards here have to be at the end. That's sort of a limitation of this particular method that I talked about. And all the paths through these graphs are going to continue to be generated. And that's, again, in contrast to normal reinforcement learning, where eventually an agent would collapse onto a single optimal path or a set of optimal paths. Here, we're going to continue exploring everything. In ongoing work, actually, we're looking at non-DAG environments as well as optimizing with rewards that are given at all the states. Now, just to give you a sense of how this works, so here we have some results on the farther graph there. We're looking at a number of modes that are being discovered using this approach compared to PPO, which is a standard reinforcement learning state-of-art algorithm, and compared to MARS, which is a really good molecular discovery algorithm. Here, the way that we've sort of constructed the reward function is by pre-training on a set of 300,000 molecules based on supervised data. And so we can see that the rewards are good in this case based on the graph here, and also we're finding lots more modes, right? So the exploration is much more diverse, which is interesting because then we can take some of these candidates and send them to the lab. And so to assess how well this actually works in an active learning setup, we take some of these batches of molecules and send them back for a more accurate evaluation, and then incorporate the data into the reward signal and sort of continue this iterative process. And we're looking here again at the comparison with MARS and with a sort of more vanilla randomized approach using VAEs. And the return here is again better when we look at these batches of top K, sending the top K candidates for evaluation. And we can play around with that K. We can send smaller or larger batches and evaluate how well that does. So in conclusion for this part, I'm showing you a generative model for discrete objects. that's based on a learning objective that's similar to Bellman errors from reinforcement learning. But really, this is actually a general setup for solving black box optimization problems. So we've mainly explored this in the space of looking for molecules. But in principle, you could use this in, for example, looking for hyperparameters for machine learning algorithms, or in looking for parameters for a device. The main strength of this approach is that it gives us diverse batches of candidates with amortized computation, so we don't really have a very expensive process. And we can actually incorporate fairly easily information about the epistemic uncertainty of the reward if it's available, right? This can be, because these rewards are in the ends of the graph, we can actually incorporate uncertainty measures and propagate those using flow equations as well. And in general, it would be really interesting to think about how to broadly use this class of methods for causal modeling in other situations as well. And we've started some collaborations in that space, but I'd be interested in talking more to people about that, in fact. Again, as before, some design of the reward function and the value function parameterization was necessary in this case. In particular, the scale of the rewards matter. Sometimes you need to put a little exponential there in order to keep things in check. And there's sometimes underfitting or overfitting problems that we're actually also trying to solve now. And this is just a collection of resources that you can use to learn more about this approach. So just to conclude, I think reinforcement learning is a very useful and underexplored tool in the space of both designing drugs, designing treatments, and understanding how to adapt these treatments to particular individual patients. It is really crucial to think about the reward design. And it is really crucial to consider specifics of the problem. And I think this is where it's extremely important in all of these cases to work in a closed loop with some clinical collaborators that can actually inform those decisions and also give some qualitative assessment of what's happening in the results that we get. Because oftentimes in machine learning problems, it's sufficient to look at returns. But in these problems, we really want to understand the impact of these policies more deeply. There's a great opportunity to actually improve existing reinforcement learning algorithms. These problems are challenging in a way that is different from, say, robotics or games or any of the other traditional environments that have typically been used with reinforcement learning. And one of the things that's coming up again and again is that we really need to get better sample efficiency of reinforcement learning algorithms. And so that's something that we're working on. So I will stop there. Thank you for your attention.